Hi, I'm Dr. Mehboob, MD ophthalmology from AIMS, New Delhi. And today I'm going to discuss about the very important topics for obviously ophthalmology point of view also and important for the examination point of view. A lot of times they have asked you questions over this topic and this topic needs to be clarified from its bottom. So let's dwell into the topic and try to know why it is actually occurring. Okay, this is the Coats disease. Okay, now the Coats disease is an idiopathic retinal telangiectasia and intraretinal subretinal exudation without appreciable sign of vitreoretinal traction. Meaning by before previously when the Coats disease was first diagnosed, it was diagnosed in a patient with enucleated eye where there is obviously everything has gone, there was massive exudation. Okay, so it was from that time this Coats disease is was actually being related to the exudations only. But remember, the exudation is not at all the criteria to diagnose the Coats disease. It is a complication or in the Coats disease, obviously. Yeah, it's true that exudation occurs in the Coats disease, but presence of exudation or absence of exudation does not exclude the diagnosis of Coats disease. So we have arrived to a definition that it's an intraretinal telangiectasia, small retinal arterial dilatation, small retinal vessel dilatations, right? So this is the telangiectasia with intraretinal or the subretinal exudations, but the traction is not there. The traction is not there. Okay, what happened mainly in the male, and it is usually unilateral in contrast to the retinoblastoma, which is in the bilateral. Retinoblastoma occurs in around 3 years of age. Okay, but this occurs around 8 years of age, first decades of life, obviously. So there is so much of confusion that the retinoblastoma, because the presentation sometimes similar to the retinoblastoma, so you have to differentiate. The most important differential diagnosis of Coats disease is retinoblastoma only. And since it is unilateral, it is bilateral, can be unilateral, but mostly bilateral. Male, more preponderance to male, but here male and female are barabar, equal. Not clearly inherited. इसमें तो Knudsen hypothesis you have remembered, you know that retinoblastoma gene is there, most of them are inherited. Obviously there are most of the genes are associated with this, but here in this Coats disease most of the genes are not associated, but sometimes NDP genes, that is the Nori disease protein gene. Okay, that is the Nori disease Nori disease भी इससे associated होता है. So can be said that it's a uh, sometimes can be considered as a subvariant of the Nori disease. The second thing is that Leber's miliary aneurysm. कभी कभी this was previously diagnosed as a distinct entity, but now as considered to be a milder form of the same disease. If you diagnose a case of Leber's miliary aneurysm, then we say that the patient will ultimately go into the Coats disease only, and it is considered to be the milder variant of the Coats disease. Okay. Now, coming to the symptoms and the signs, whenever the Coats disease are actually occurring, so the telangiectatic vessels can be in the center, posterior pole, can be in the periphery. Okay. Now, what are the symptoms that the patient presents with? The first symptoms that the patient presents with is a visual acuity. Visual acuity. Then there can be leukocoria, that is white pupillary reflex, and you have to differential diagnose. You have the lots of differential diagnosis of leukocoria. Then when there is a visually deprived eye, suppose this eye is visually deprived, obviously this becomes non-dominant eye and this eye becomes dominant eye. So the non-dominant eye, the affected eye will deviate and they can cause the strabismus. But in some cases nothing will happen. Why? Why nothing will happen? Because of the presence of the telangiectatic vessel in very periphery, no exudation takes place, remains there as it is, no symptoms takes place, only incidental finding. So these are the symptoms. What are the signs then? Obviously, I have told you about retinal telangiectasia in the definition only. Then I have told you about the intraretinal and the subretinal exudation in the definition only. What happened because of this telangiectatic vessels, obviously the VEGF will be released and they can lead to the neovascularization of iris. This is very important to understand. Can lead to the neovascular glaucoma in a very advanced cases. And obviously there is the exudation, so it can cause what type of detachment? Exudative retinal detachment. See, retinal detachment RD can be of three types. Most important is rheumatogenous. Okay, rheumatogenous RD. Second is the tractional RD, and third one is the exudation RD. Exudative RD. So exudative RD will take place only in those conditions when there is an infection, when there is a inflammation. Okay. So here there is an inflammation, exudation. So there the retinal detachment which will take place here will be exudative only. Got it? See, these are the things that I must tell you about. Can you see the first picture? Just see the first picture. Here the line will show the leukocoria, pupillary reflex. See the pupillary reflex of the child. Now, can you see here? Here in this area, it is not well prominent, but you can see the some dot-like vessels. This is telangiectasia, and in the vessels here you can see the aneurysm. Here also aneurysm. Okay. Now what is happening here? There is an exudation which is masking the blood vessels. Can you see this white exudation which is masking the blood vessels? What happened? What happened in the exudations when there is also the healing process? There is a gliotic seeding of the retinal vessels. See the silvery lining here. Can you see? Can you see the silvery lining here? Here. So these are the gliotic seeding only. This is also a part of the Coats disease, right? Now, when you do this FFA, what happens in the FFA? You can see obviously very easily the dilated vessels, aneurysmal dilatations, and the telangiectasia here. The dilated vessels and the telangiectasia here. This is the early phase. In the late phase, the whole of the, this is what? This is the hyperfluorescent area. Why? Because of the hemorrhage corresponding to this hemorrhage part. Okay. And these are the blocked fluorescence area. So this is basically a picture, a typical picture of the Coats disease. And this has been quoted from the Kansky book, a very authentic book, very authentic picture. Now the latest followed classification, that is the Shields classification. There are so many classifications that they have given, Shields classifications. Okay. Then the last one that is very important to remember, that is the Shields classification. However, it is not so much important for your label. But if you want to learn, you can learn. Stage 1, retinal telangiectasia only. Stage 2 with exudation, extrafoveal exudation or foveal exudation, A and B. Exudative retinal detachment can be subtotal or total. Subtotal में extrafoveal or foveal, and the 4 is the total retinal detachment with glaucoma, and the last is advanced stage disease. Okay, the next slide is on the differential diagnosis of the Coats disease. Leukocoria have you seen? So the most important differential diagnosis is retinoblastoma. You can easily identify the toxocara, differentiate it. You can easily identify it from the retinopathy of prematurity, from the pars planitis. FEBR means foveal exudative vitreoretinopathy, or Eels disease, not discourse disease, and Norris disease. Why? Because NDP related retinopathy, na? NDP related retinopathy. Coming to the important thing that I have to discuss, that the differentiation between Coats disease and retinoblastoma. Just see, the important point to understand that the Coats disease is unilateral and in the male, but the retinoblastoma is mostly bilateral and can occur in equal amount in male and female. Second point, age is very important. Around in the first decade, but around 8 years. Here, less than 3 years of age. Very important to understand. Calcification. Calcification is not at all takes place in the Coats disease. रेटिनोब्लास्टोमा में calcification होता है, and you identify the calcification by USG, ultrasonography. If at all not finding, you can go for the CT scan if you want, but no need. Extra money, no need to spend. Vitreous seeding absent means the localized lesion does not gives a small lesion into the vitreous, which can seed into the other part, which can settle down into the other part of the retina and create the disease. Unlikely in the retinoblastoma, if see, if this is a lesion, suppose in the right eye, if there is a lesion here, okay, if there is a retinoblastoma lesion here, then it can give a small lesion into the vitreous. It can seed a small lesion into the vitreous, and this small lesion can come here, and then create a disease here, It can also go anteriorly. So this is what I mean to say about the vitreous seeding, which is present in retinoblastoma, not in the Coats disease. Got it? Coming to the important point, that if after you have diagnosed the Coats disease, very good, you have diagnosed the Coats disease, now what you need to do is to manage. The first thing that to be managed here is observation. If suppose there is a no threat to the vision, only telangiectatic vessels you see, but no exudations near the fovea, nothing at all, then you are obviously in stage 1, better we can say. No threat to the vision, just observe. If there is a telangiectatic vessels with exudations and no SRF, SRF means subretinal fluid, no subretinal fluid, then what is important? Obviously you are going to do laser, because with this if there is a subretinal fluid, the laser will not be much more effective. If there is an exudation with SRF, you are going to do cryotherapy, and if at all there is a retinal detachment, obviously you have to go for the surgery. When there is a peri-advanced eye disease stage 5, remember the SILS classification stage 5, painful blind eye, you are going to treat by the enucleation. And obviously if there is a chances of NVI is high risk, obviously you are going to give anti-VEGF. This is about all about the Coats disease. All you need to know the differentiating point from the retinoblastoma and the photo that I have shown you to revise that. That's it. So thank you guys for watching this, and do watch all the lessons. That's quite interesting. Thank you. Obvious and